Hello everyone, my name is Anna Criswell, and today I will be giving a presentation about understanding students with ADHD. So, exactly how many students in the United States have ADHD? Approximately 7% of students are identified as having ADHD. When I first heard this statistic, I was shocked because I actually thought it would be much higher. I think we all know someone who's been diagnosed with ADHD, and it seems fairly common in education, and it's something that is especially common in special education. And the number of students who are diagnosed with ADHD has actually increased in recent years. Research suggests that rates have increased by approximately 30% since the late 1990s. This is a very significant increase, and many researchers have tackled the job of finding out why these increases have occurred. And they've found out that for the most part, it's not because more students are being born with ADHD, it's because more students are being diagnosed than would have been diagnosed in the past. This rise has been most pronounced in minority groups, which suggests that better access to health insurance and mental health treatment through the Affordable Care Act has played a big role in the increase. There's also a better understanding of ADHD by doctors and just the public in general. Parents and teachers are becoming more educated about ADHD, and it's becoming less of a taboo topic. There are also new standards for diagnosis that help medical and educational professionals diagnose students with more confidence. So here are some behaviors and characteristics of students with ADHD. There are a lot of tasks that students with ADHD might have trouble with, and some of these include paying attention, listening, following directions, organizing, keeping track of things, avoiding distractions, remembering things, staying still, waiting their turn, and participating quietly. As we go down the list, it becomes very obvious how all of these could complicate learning and complicate a focused classroom environment. And it's important to remember that not every student with ADHD is going to have all of these symptoms or all of these struggles. This is just a general list. So next we'll talk about how these characteristics make it difficult for students to learn and participate in school. So it's difficult for students to learn without being able to stay focused on the teacher and the lesson. And a teacher might explain an assignment, and students with ADHD will get distracted and have trouble following the directions. And then if they have to take that assignment home and do it by themselves, they'll have a really hard time because they won't remember the instructions and they won't know what they're supposed to be doing. And they might have difficulty remembering that they even have homework at all. And if they don't complete it, that can result in them getting bad grades and losing hope, giving up, and just getting frustrated with school. So organization is something that they also struggle with. And these behaviors not only affect students with ADHD, but they also affect their classmates. So, not only do students with ADHD have trouble paying attention themselves, but they also distract other students. And students with ADHD might interrupt the teacher, interrupt other students, take the teacher's attention away from other students, blurt out answers, have trouble waiting until their turn, talking excessively, moving around in their seats, etc. So obviously all of these behaviors would have a negative effect on their classmates as well as themselves. So next we're going to talk about their unique characteristics and degrees of behavior. As I mentioned earlier, there's not like a set list of behaviors that each student is going to have. It differs. So under the DSM-5 diagnostic criteria, there are 3 subtypes of ADHD. These include predominantly inattentive, predominantly hyperactive, impulsive, and combined. Within each of these groups, there are particular characteristics and behaviors. Students with predominantly hyperactive, impulsive ADHD are often described as displaying fidgetiness and being in constant motion. So they have a hard time staying still. They display their ADHD externally, whereas students with predominantly inattentive ADHD display their ADHD internally. And students with predominantly inattentive ADHD are not as disruptive as those with hyperactivity, impulsivity. They often display a slow tempo in their approach to academic tasks, boredom, lack of motivation, and self-consciousness. There's also a third group of students who have both inattention and hyperactivity, impulsivity. So despite these groups that I've just named and the associated behaviors, each student with ADHD is individually different, and each student is going to have different struggles, and they're going to need individualized help. So that's something to remember. Okay, so according to the IDEA, ADHD actually does not have its own category. Instead of listing ADHD as a separate disability category, IDEA includes it as a subcategory of other health impairments. But students with ADHD are not only served under this category because of coexisting disabilities. Students with ADHD are often also served through IDEA in the categories of learning disability, emotional or behavioral disorders, and intellectual disability. So there are many different options. So lastly, we're going to talk about effective class-wide interventions. And the three that I have listed are multimodal treatments, errorless learning, and video self-modeling. So multimodal treatments can be very effective for students with ADHD. They involve multiple interventions across multiple modes of therapies. Common components of multimodal treatment include medication, parent training, behaviorally oriented treatments, and classroom behavior management. So moving on, our next strategy is errorless learning. It's an instructional strategy that minimizes the mistakes students make when learning a task. And the idea behind errorless learning is that learning without mistakes is more effective, and the learning lasts longer. They will be able to remember what they've learned for a longer period of time. So when using errorless learning, teachers present the information to the student, and they arrange the delivery or the prompts in such a way that the student can only give correct responses. So the idea with that is that the way students learn normally, they might use trial and error, and they'll guess wrong answers, and then they might have trouble remembering which is the right answer. So if you only supply students with the correct answers, then they won't get confused, and they won't have to relearn something that they've learned incorrectly. So the third intervention option that I've listed is video self-modeling. It's useful for promoting outcomes such as goal setting and self-management for students with ADHD. And it's pretty much just what it sounds like. In video self-modeling, students watch videos of themselves performing skills correctly. This practice involves recording students performing desired behavior and then having them watch the video and imitate or repeat the desired behavior that they exhibited in the video. The strategy teaches self-regulation, among other skills. So those three intervention strategies are all very effective, and a combination of all three might be best. So that's all I have for you, and I hope that you remember this information when teaching students with ADHD, because they have different struggles and might need a little bit of extra help, and I hope this presentation helped you to understand them better. So thank you for listening.